Deputy Kenny, you're fine.
Thank you, Cathaoirleach. I warmly welcome the fact that free GP care will be available for children under the age of 6 and for people over the age of 70 from the end of June this year. This is a major step forward that will deliver huge savings for families and for pensioners and help promote health and well-being throughout the population. People over 70 who currently have to pay to see their GP will now be able to access the free service. This is the latest phase in the overall plan to provide free GP care to all our citizens. The government is making progress already with plans to roll out free GP care to children under 6. The reason these two groups are getting free GP care services extended to them first is because these two groups, the youngest and the oldest members of society, have the greatest need for health care services. It is intended to have the legislation in place this year and to have the actual service introduced alongside the free GP care service for children under 6. Free GP care is a fulfilment of what the government is committed to in terms of introducing a universal GP service for the population on a phased basis, and I am pleased to see that it is being implemented gradually. From this summer, up to 300,000 children and senior citizens who currently have to pay to see their GP will no longer have to do so. This is a big step forward in terms of how people across the country, particularly the youngest in our society, avail of healthcare services. Some 240,000 children will be able to benefit from this new development when it comes into effect. This will mean real savings, as I've said, for pensioners and for families, but it's also much more about that. The new enhanced service covers all children under 6, including those who have medical cards already. They will benefit from the management of asthma in general practice and preventive wellness checks. Adults will also benefit from the new diabetes programme, meaning they will have their condition managed by the GP who knows them rather than in a hospital clinic. Under the new arrangements, Cathaoirleach, an additional 200,000 children will benefit from GP care at the point of service. All children under 6 will benefit from the new enhanced services under the proposed GP contracts. This will involve age-based preventive checks focused on health and well-being and the prevention of disease. These assessments will be carried out when a child is age 2 and again at age 5 in accordance with the agreed protocols. The contract will also include an agreed cycle of care for children diagnosed with asthma, under which GPs will carry out annual reviews of each child where the doctor has diagnosed asthma. The extension of GP care at the point of service to everyone over 70 who does not currently qualify will take effect at the same time as the under 6 service. This service will benefit approximately 36,000 new patients and will be provided on the existing contractual arrangements for this age cohort. The negotiations with the IMO have resulted in an agreement on the introduction of a diabetes care cycle of care. This will enable patients with a medical card or GP visit card who have type 2 diabetes to avail of 2 annual visits to their GP practice for a structured review of their condition. This service will begin in Q4 of this year. This initiative will help to integrate care across the continuum of care, will improve clinical outcomes for patients and reduce complications often experienced by people with this condition. Making health care more affordable has long been an objective of the Labour Party in government and underlines Labour's commitment to enhancing primary health care. I want to thank Minister for Healthcare and Minister for Primary Care, Kathleen Lynch, for her tenacity in pursuing this project, despite the many barriers that they both faced along the way. It is certainly fitting that a Labour Minister would deliver such a meaningful project in line with our policy of supporting families and ensuring that they share in the economic recovery that is now clearly underway. I warmly commend this legislation to the House. Thank you.